coming up in the next half hour.
I know this sounds bad. I'm glad that cancer came along when it did. This kind of cancer.
Prostate cancer. It's common and curable if caught early. And the cure comes in many forms.
He said the best thing for us to do is to sit down and talk about what do you want to do.
2 men, many choices, 2 very different treatments. And radiation therapy delivered from outside or even inside the body.
Little radioactive seeds, they call it, about the size of a grain of rice. They actually place them inside the prostate.
Radiation, surgery, or something else entirely. Welcome to the Morning Medical Update. Cancer, choices, hope, and science. We are coming to you from the Dulcie Simons Jr. Family Broadcast Studio here at the University of Kansas Health System. I'm Jessica Lovell. Prostate cancer is one of the most common cancers. 1 in 8 American men will get it, according to the American Cancer Society. And the statistics are even worse for black men. Thankfully, prostate cancer is often slow growing. If you catch it early, it's survivable. And more awareness has led to more research, which has led to a range of new treatment options. When Paul Henson learned he had prostate cancer, he did what he does best, research. And as Janine Kiesling shows us, he decided on a special kind of radiation treatment.
6 days a week, Paul Henson and his son John can be found working out together. It's a tradition that began last year after Paul was diagnosed with advanced prostate cancer.
I jumped on the fitness train right away. I mean, that is the way to counteract the side effects of treatment for prostate cancer.
That head-on approach is how Paul lives his life and what he credits with his success as a lawyer, a dad, and husband. It's also what led him to the University of Kansas Cancer Center.
I'm an attorney. You never just believe the first thing you hear. With medical stuff, it's just pretty standard for me to say, I'd like another opinion.
Paul was methodical in his research and actually talked to several doctors before he made up his mind. He knew he didn't want surgery. Instead, he wanted to try a multimodal approach: radiation, hormone deprivation, and brachytherapy. Brachytherapy is a cancer treatment in which radioactive seeds are implanted in the prostate with needles to kill nearby cancer cells.
The good sources indicate that brachytherapy combined with radiation and hormone therapy is a very good treatment and decrease the chances of reoccurrence to, well, practically zero.
As for the right doctor, once Paul says he talked with Dr. Ronald Chen, his mind was made up.
He clearly knew what he was doing, had a lot of experience. He was just as willing as could be to answer questions from a patient like me who kind of demands that the doctor articulate why he wants to do a certain course of treatment. Dr. Chen was good at that, better than the other doctors that I had already seen.
Paul says his cancer responded to treatment right away and is almost undetectable in his blood work. He expects to make a full recovery and says his diagnosis has only made him stronger and couldn't have come at a better time.
Here, it's a comprehensive cancer center, one of the 53. It's not like I got to drive from Liberal, Kansas or something every day for treatment. I was retired, so I didn't have to work around a job. I have Medicare, so I don't have to work around insurance. It's like getting a flat tire driving past the tire store. You can just turn in and get it fixed.
Hello, welcome to Radiation Oncology. Is this your first time here?
Well, that's what I feel like prostate cancer diagnosis was for me. It wasn't bad, it was good.
And we are happy to have Paul Henson joining us now, as well as Dr. Ronald Chen, radiation oncologist and the chair of radiation oncology at the University of Kansas Cancer Center. Nice to see you, doctor. Paul, let's start with you. We just heard you say that the prostate cancer diagnosis for you wasn't bad, it was good. Can you just tell us more about that?
Here I was in my late 60s, and I had just retired, and frankly wasn't in the best of health. And I just think that without this coming along when it did, I never would have just started down that road to health, started working out and made changes to the diet. Everybody says you should do that, but it just takes a motivator to start. So from that standpoint, the diagnosis was a good thing for me.
Yeah, it's almost like it made it so you had time to take care of yourself and seek good treatment. You could have had surgery. Why did you want radiation instead?
Well, I did my research on that, and surgery is one option, radiation another. I became convinced after doing research that radiation was going to be the right road for me because the side effects are different with the different treatments, and I thought the radiation side effects were more tolerable, more acceptable to me. And then when I met Dr. Chen, that kind of confirmed in my mind that this was going to be the right road for me.
Dr. Chen, was Paul's cancer at risk of spreading? And if so, does that impact treatment?
Absolutely. I mean, with every cancer, and prostate cancer included, there's different stages of diagnosis. And Paul's prostate cancer was at a higher stage, and so it was at risk for spreading. And of course, then the treatment for every stage is different. So with Paul, and so I think for every prostate cancer, the first thing you need to understand is, well, what stage am I, or what risk group am I? There's low, intermediate, high. Paul's was in the high risk category, and so we designed a treatment plan specifically for that.
So Paul chooses radiation over surgery, but then he still had to decide what form of radiation to get. So tell us why proton beam therapy was right for Paul.
Yeah, I think for radiation therapy, for any treatment, there's two very important goals. One is we want to minimize side effects as much as possible. The other thing is we want to offer the highest chance for cure. And there's many forms of radiation treatment now for prostate cancer. Proton therapy and the brachytherapy, which is called radioactive seeds, are actually the two most accurate forms of radiation that can target the prostate and treat the cancer with minimal radiation dose outside. And for Paul, we use both proton and the seeds to design his treatment plan.
So, Paul, you're coming to the hospital day after day for 5 weeks. Is it fair to say that your medical team is kind of like family now?
Oh, well, definitely. Every day for 5 weeks, even the people that park the cars and the receptionist and the proton team, they're just part of my cancer journey, and hopefully I've become a little part of their lives.
Certainly so. So after proton therapy, why the brachytherapy? Why place radioactive seeds inside Paul? Is this common, Dr. Chen?
Brachytherapy actually is a very effective way to treat prostate cancer. There's long-term clinical studies to show that it's very safe and effective. For Paul specifically, because his cancer is a higher risk, which is more aggressive, brachytherapy was a really important part of his treatment. In this procedure, we were able to put little radiation seeds directly into the prostate. It doesn't get any more accurate than that. We can put the treatment exactly in the prostate without going through other tissue, and it's really also where the radiation can have the most effect to really directly treat the aggressive cancer. And so for Paul, the proton therapy helps us treat a little bit of an area outside the prostate, and the brachytherapy really focused on inside the prostate, and that combination to us offered the best chance for cure for Paul's cancer.
So during all of this, Paul, you've been getting hormone shots basically to wipe out your testosterone. Are you still getting those? Well,
I am. In fact, I went in for my very last hormone blockade this week. So the testosterone will be blocked for, a period of time. I kid my wife saying, hey, there is just no testosterone in this body, period.
Another thing you've been doing, you've been working out a lot. Is this above and beyond doctor's orders?
Well, I think the level that I do it, when I became aware of what the side effects to the hormone treatment were going to be, loss of muscle, loss of bone density, I just decided that is not the way to age gracefully, is to allow yourself to get weak. So John and I made a commitment that we would work out 3 days a week, and then I work out by myself 3 days a week. And we've now continued that for 10 months since the diagnosis.
Good consistency post-surgery. Dr. Chen, does working out help with these side effects? Is Paul doing it right?
Absolutely. Well, with any cancer treatment, there could be side effects, and with hormone therapy, one of the possible side effects is fatigue and maybe some weight gain. And what I always do is I encourage patients, even going through treatment, to be active. And in Paul's case, he's actually more active than he was before treatment. And being active can actually counter some of these side effects like fatigue and muscle loss. And Paul's doing it just right.
Yeah, Paul, keep it up. So also, Paul, stay with us as we meet another prostate cancer patient. We're going to come back to you and Dr. Chen here in just a moment. Instead of radiation, this man wanted his prostate taken out completely. Here again is Janine Keesley.
Randy Collins loves life. It only takes a minute talking with Randy to learn why that is. His family, his faith, and the Kansas City Chiefs.
He's definitely the biggest Chiefs fan ever. Whenever he says show up in Chiefs gear, that's what we do.
Randy and his wife Lila started dating when they were teenagers. Together, they have 7 children, and they are a tight group. So when Randy learned his prostate cancer, which had been laying dormant, was now at stage 2, his doctor sent him over to Dr. William Parker at the University of Kansas Cancer Center. Of course, this second opinion would be a family affair.
It was me, my wife, my daughter, my sister who lost her husband, and my brother Kenny. They had to ask for permission for all the family to come in one room so they can help me make the decision on what I wanted to do.
That meeting that we had with him, though, it did help us to better make our decision. Like, he did have the knowledge and give us enough information and explained it in a way that was understandable.
All right, you ready for this?
Yes.
Okay.
One big surprise was learning that prostate cancer is a leading killer of African American men.
All right, well, let's get it done.
Right.
Get you on the flip side of this thing.
Information that helped Randy and his family choose surgery because removing the prostate offered the greatest chance for Randy to enjoy a long, healthy life. With his team from the University of Kansas Cancer Center, Randy is ready to put cancer behind him and get back to living the life he loves.
Get up, dust yourself off, and try again. You know, like the Chiefs did. It took them 50 years, but they got it done.
And of course, in his Chiefs gear with us today is Randy Collins. So glad you could join us alongside your daughter, Camille. We also wanted to invite your urologic oncologist, who is also your surgeon, to join us here at the desk, Dr. Will Parker. Good to see you.
Good to see you again.
So Randy, I'm curious, a lot of patients can't have their entire family along for a doctor's appointment because it's kind of hard to get everybody to agree or on the same page. Randy, just tell us a little bit about who came to your appointment. What was that like?
It was my brother, my wife, my daughter, and my sister. They came to the meeting with Dr. Parker, and we're all close. My whole family is close, so they wanted to be a part of my decision on making what I wanted to do. So at first I was gonna be like Paul. I was thinking about doing a proton beam, and they said no, because I was doing our research on it. And they said, just go ahead and get it taken out. So I thought about it for a couple of weeks, and then I called Dr. Parker, and Dr. Parker said that was a good decision.
So Camille, why was it important for your whole family to be a part of this?
We needed to show him that he had support. We're really big on that. We're a huge family on both sides. And I'm a bit of a stickler when it comes to my dad. And he can sometimes be a little hard on himself. So we definitely needed to be there and show him that he was making the right decision and that he had the support that he needed throughout that decision and the process.
Sure. And Dr. Parker, I bet you love it when it's kind of a family affair. Everyone's there listening and taking in the same information. And I've seen those clinic rooms, not a lot of space to fit in the family. But what was it like, though, to have everyone present when talking about Randy's care and treatment?
I mean, at first, beyond the logistics, which I think we had to get really creative to get everybody into the room, I think it's so important to have everybody who's engaged in this subject in the room together. Making the decision about cancer treatment often is more than just an individual decision. It's a family decision. You need your support structure to know what's going on. And it's really important to me that everybody in Randy's family knew what was going on, what the options were, so that everybody could get their answers, the questions that they had answered.
Sure. And Camille, what kind of support or guidance did you give your dad along the way?
Mental support, physical support, just really, oh, Daddy, don't.
I ain't crying. I'm sweating. That's not a tear, that's sweat.
Just encouragement as well. I'm the oldest, and I always feel like I have to be there again, physically, mentally, just to push him and let him know that everything's going to be okay and that he has the people here that needs him here. So I just, yeah, that's pretty much it.
Well, it's okay. We can see the family love here. It's okay, Randy, to leak a little bit, okay? Dr. Parker, clearly surgery was a good choice for Randy. Are there different types of prostate surgery? It can't just be one size fits all, I would imagine.
Correct. It's definitely not. And I think this really goes into what Dr. Chen was alluding to earlier about radiation. We often simplify the discussion of prostate cancer treatment to it's just surgery or it's just radiation, and it's really a lot more nuanced than that. Once somebody elects to do surgery, there are disease features that go into how we might approach the surgery, how we might save surrounding tissues for sexual function or for urinary function. And so it's a bit of a decision-making process between us as the providers and Randy, the patient, to come up with what's going to be the optimal treatment that meets the goals of cancer care with quality of life at the end of it.
So, Randy, it's been about 3 weeks since your surgery. How are you feeling? How's your recovery been?
It's been slow. A couple of days ago, I wasn't feeling too good, but I managed to make it through it. But it's been real slow. Just sometimes it's a little annoying trying to, turn your body over again on what you need to do. But, I'm staying motivated and it's working out pretty good.
Following doctor's orders. So, Dr. Parker, when did some of those side effects start to subside a bit?
It comes in waves. There's some, the initial period where, unfortunately, Randy's in the thick of it right now with what tends to be the hardest part of the recovery. There's some rapid recovery that happens during those first few weeks and months. And then things just gradually get better day by day by day until most of the side effects should resolve.
Back up and running again. So we had mentioned earlier that Black men get prostate cancer and die from prostate cancer at higher rates. What's behind this racial disparity, Dr. Parker? What can we attribute that to?
There are a lot of factors that play into that disparity. Some of it is, some social determinants of care, some how the healthcare system is organized. We know that there are healthcare disparities that begin long before patients even are diagnosed with prostate cancer, when we're speaking specifically about prostate cancer. And that can influence when people get diagnosed. They may have more advanced disease, and that sets them up for worse survival outcomes. In fact, there's data that show in systems where there's equal access to care, outcomes are relatively the same. And so we do believe a lot of the disparities is on us, as a healthcare system, ensuring that there's equality in access to care and equality in how we approach this process.
And Randy and Camille, you actually were surprised to learn about these disparities, even though you actually had friends and family diagnosed and even die of the disease, right?
Yeah. My brother-in-law passed from it about, 5 years ago? It's been about 5 years. He had prostate cancer, and he was in stage 4 within about maybe a couple years. So there was nothing more that he could do but just make him comfortable.
Dr. Chen, what can you add to this conversation regarding racial disparity?
Yeah, and this is actually an area of a lot of interest of mine. I do research in this area. It's also an interest, I think, of passion to try to solve this problem. I do think what Dr. Parker said is absolutely correct. There are some groups of men, like African American men, who are more likely to develop prostate cancer. They're more likely to develop at a younger age. There's also, I think, some groups of patients who have different treatments and may not have heard about all the treatment options before they jump into what they decide to do. I think one of the major ways to solve the disparities is one with screening. I think for men, getting screening when they're of age, whether it's 40 or 45 for African American men, getting screening on a yearly basis to catch it early is one big way to solve the disparities. And I think the other thing is really for men with prostate cancer need to be informed of the treatment options that they have and choose the right treatment for their disease. And I think with both of those things, disparities can significantly reduce.
Let's back up and talk about the most important part, as you said, screening. Again, tell us those ages and when men should start thinking about getting screened.
Yes, there actually is a little bit of controversy that people may hear about prostate cancer screening. A PSA may or may not be accurate and all that stuff, but actually it is quite well established that cancer screening saves lives, and prostate cancer screening saves lives for men. I think some of the guidelines would say that for an average male, age 50 is when you can start screening, and that often includes a PSA test annually with your primary care doctor. So age 50 is the usual age. For men that are at higher risk for developing prostate cancer, whether you have a direct family history, your brother, your father, your grandfather have had prostate cancer, or if you're African American, also a higher risk, then that goes up to either age 40 or 45. But those are the numbers to remember: 40, 45, or 50 for average risk. That's when men need to have screening on a yearly basis.
Dr. Parker, anything to add regarding the importance of screening?
No, I would second. I mean, this all begins with screening, right? There is data that show that we improve survival, men live longer, we treat better when we have early detection, and that's all driven by appropriate and early detection, right? Screening. And so I think it's very important to be advocates of your health. Unfortunately, as Dr. Chin commented, prostate cancer screening is controversial. And so it's not that your primary care physician may just automatically offer you screening. Sometimes you have to actually ask for it and say, hey, I'd like to have this done. And knowing those ages, as Dr. Chin was pointing out, is so very important. Very important to know.
So we've talked about surgery, we've talked about radiation, but there's also a newer treatment called high intensity focused ultrasound, or HIFU. And Dr. Parker, we want to show some animation of what HIFU is. Just better explain what's happening and how it kills this cancer.
Absolutely. So high intensity focused ultrasound is a way of delivering energy to create heat to try to ablate parts of the prostate as opposed to treating the whole thing. So when we do radiation surgery, we're removing or radiating the entire prostate. This is a way of saying, well, maybe if a person has a very focused or localized prostate cancer, we could just target that area and treat that one location. And that's what this aims to do. There's very good data for success rates and control with using this approach. And so essentially what this graphic or this animation is showing is just how this is delivered.
Well, we love answering questions directly from the community. We ask medical teams for some common questions that they get from patients. And the first one is, if diagnosed and doctors say, well, just watch it, what does watching it mean? And I think what they're asking is there some type of risk spectrum. Dr. Chen?
Yes, I briefly talked about this before, but I think the first question, somebody diagnosed with prostate cancer, the first question you should ask is, well, what stage am I, or what risk group am I? And in prostate cancer, based on your numbers and the biopsy results, you're either low risk, which is the best group, or intermediate, or high risk that gets more aggressive, or metastatic if it's spread outside. And so for low risk, which is often the slow growing kind of prostate cancer, this is when active surveillance or just monitoring would be a great option without having to jump straight to treatment. But if you have more aggressive cancer, intermediate or high risk, then oftentimes treatment is more appropriate and we don't want to just watch it.
Next question, Dr. Parker, what is and how reliable are the PSA tests?
So PSA, or prostate-specific antigen, is a blood test. It is a good test, not a great test. So I think a lot of the controversy about this is related to the fact that PSA is an imperfect tool in screening for prostate cancer, but it's the best first tool. Like most things in medicine, nothing is perfect. There is no absolute guarantees with anything, and PSA is subject to those same issues.
Another question is, once I'm done having kids, do I need a prostate?
Well, I mean, so the prostate is a reproductive organ, so if we're going to go just pure once I'm done, then no, you don't need a prostate anymore because that's its sole job, is for reproduction. Unfortunately, the prostate is also anatomically situated in a part of the body that you would like to keep your prostate if you can, because it does have functions with urinary control and sexual function beyond just reproduction.
I want to get to today's takeaways. And Randy, let's start with you. What's your message for everyone watching and hearing your story?
Swallow your pride. Go get checked out, for prostate cancer. It's just, especially among Black men, they need to get checked out. It's a very uncomfortable thing, but please get checked out. Your life is more important than, your pride.
Yeah, I love that. Swallow your pride. Great message. Paul, what's the takeaway from your story?
Well, I echo the advice to get checked. And more than that, 1 out of 8 men are going to face this. The doctors will do their part and give us the best treatments that are available, but we have to do our part. And that means having the right diet and the right exercise routine. You can't just sit around and let all the rest of the body functions deteriorate. Like they say, aging is inevitable, but getting old, well, that's voluntary. And it takes some motivation, and it takes a lot of discipline. But we want to age gracefully. We want to we want to have a good life for the decades we have left. So my message is get out there and get active.
Paul, Randy, and Camille, thank you so much for being with us today and sharing your stories with us. We really appreciate it. Dr. Parker, what is the most important takeaway from today's talk?
For me, with prostate cancer, it's understanding this is an incredibly nuanced and complicated disease. And so it's very important, if you're going through this, to make sure that you get second opinions, that you get the information that you need to make sure that you're able to make an informed decision. At the end of the day, an informed decision requires information. And so don't be afraid to ask questions. Don't be afraid to try and seek out the experts in the field that you need to talk to make a decision.
Like both of you. Dr. Chen, what's the takeaway?
Well, actually, I have a very similar message as Randy. It's about screening and the importance of screening. We show the risk groups and the stages of prostate cancer. With screening, we can diagnose more people toward the low risk end, where we can either watch it or there's a high chance for cure. That's what we need. Without screening, if we don't go to the doctor and have our annual PSA check, without screening, we're going to be diagnosed more at the high risk or metastatic end, which is not what we want. So age 50 for normal risk, age 40 to 45 for higher risk men to start screening. PSA test is not perfect, but is a very good screening test, and we need to do it.
And ask for it, you said, Dr. Parker,
Correct.
if it's not being presented to you. Thanks again to all of our guests, and thank you for watching.
Coming up on the next Choices, Hope, and Science.
Her little life is counting on them to do everything that she needs, and people show up and they care and love for her.
You want to have the best team possible on your side. The best doctor, the best dosimetrist, physicist, nurse, and that team of operating the machine really makes a difference for every patient.
There'll never be enough thank yous for all of those people helping Kamaya get to be where she's at now.
Witness patients at the forefront of healthcare. Watch Choices, Hope, and Science.
Hi, I'm Dr. Ron Chen, Clinical Service Chief of Radiation Oncology. If you have an elevated PSA, are at high risk for prostate cancer, or have been diagnosed with prostate cancer, you need to see an expert who treats only prostate cancer. Call 913-588-1227 to connect with a nurse navigator today.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.